Aloha, good afternoon, everybody. My name is Sarah Henly-Shepard. Thank you for being here today for our Ignite talk. I'll move so that you can see the screen. It's called Integrating Public Health Considerations into the Post-2015 DRR Framework. Also with me are my colleagues, Ella and Ramona. So I just want to do a quick poll for whoever's listening, whoever's participating. If you could I want to get a feel for who's here. If you could raise your hand if you represent an NGO or a nonprofit. Okay. How about government or military? Okay. Private companies, private sector, academia, research institutes. Okay, great. So we have a really diverse group. I'm going to ask some questions. I'm hoping that you all feel comfortable to give me some feedback. First, I'm just going to do a brief introduction to who AmeriCares is. We are a global health and emergency response organization. We're dedicated to saving lives and building healthier futures, and we do this through various activities focusing on response, recovery, risk reduction, and preparedness. We work in at least 25 major disasters around the world every year. We have offices all around the world, and we've been doing this since 1982. So some of the main objectives for integrating public health into the disaster cycle are focusing on providing critical medical commodities, such as we're doing in West Africa, to support the Ebola crisis response. We're working to restore health services post-disaster and encourage continuity of care. We also work through our partner organizations to address psychosocial and mental health needs, like we've done here in Japan and in the Philippines. And finally, we're focused on preparedness and disaster risk reduction projects in various countries, and that's what will be the focus of our talk today. Here's a snapshot of all the work we've done in Japan to provide that local context. We've worked through local partners, some of whom are here today, to offer counseling and support to survivors, emergency response and evacuee services, among others. So how does AmeriCares fit in with the HFA? We have built a public health inclusive disaster risk reduction guidebook and toolkit. We're in the pilot stages. We're working with many local and international NGOs, government organizations, and so forth to build on the HFA, as well as other research frameworks, international policy frameworks, and so forth, to strengthen institutional and community-based disaster risk reduction capacities. We're also integrating public health into local, municipal, and eventually national risk assessments so that they're considering public health hazards, vulnerabilities, resources, and capacities within the overall risk assessment, which often goes unincluded in risk assessments. We're also developing public health sensitive early warning systems so that communities and public health institutions have the mechanisms and tools and processes to identify through monitoring and alert the appropriate authorities when there are public health emergencies, such as vector-borne disease epidemics or communicable disease outbreaks and so forth. And again, a lot of early warning systems are only focused on physical hazard warnings and alerts and evacuations, and so we're broadening this perspective and this definition of risk to be public health inclusive. And finally, our guidebook is really focused on developing this curriculum that educates, informs, and raises awareness of community members and public health institutions in many countries to enable them to go through a process where they understand core concepts of DRR, they identify their own risks, resources, and vulnerabilities, and then they prioritize based on a series of processes what it is that they want to reduce, what it is that they want to improve, and really focusing on reducing root cause vulnerabilities. So some of the challenges that I'm sure many of you know in the HFA, public health was only mentioned once. It was mentioned in Priority 4, and it was focused on infrastructure of safe hospitals. It's extremely important, but we know that public health is so much more. So what we're doing is building on these experiences from the HFA and forming the post-2015 framework for disaster risk reduction by working through women's major groups, NGO major groups, our partners internationally, to try to inform best practices and share lessons learned, be transparent, be accountable. So briefly, why is this important? Hopefully the folks that are here are already here because they think public health is important and the integration of public health into DRR is critical. The reason this makes sense and is really just so simple is because for centuries, people who have been public health practitioners have encouraged us to look upstream at the root cause of illness or disease. That's exactly what we're supposed to do with disaster risk reduction. So it makes a really natural fit for offering this public health lens. AmeriCares doesn't just focus on the institutional piece of preparedness. We're looking more at human-centered, so understanding human security as an all-encompassing thing. We're not just looking at do they have access to medical services, but also supporting their well-being, their mental health well-being opportunities for capitalizing on public health. But then this is nested within a broader resilience framework. So you cannot just look at human systems, you cannot just look at infrastructure, government, but looking at this resilience framework that's interacting all the time between these different systems. Because what we're hoping for is to create a model that improves accountability and transparency, which is something that the post-2015 framework could really benefit from, is having tools and mechanisms that encourage transparency. We're also very much so supportive of looking at all-encompassing risk that includes daily chronic risks, such as those that arise from livelihood insecurity, malnutrition, environmental health hazards, poverty and education issues, and so forth. We're not just looking at the physical hazards, which many of you, I'm sure, are doing as well. And they're also looking at the cascading disaster impacts as multiple entry points and opportunities for disaster risk reduction, focusing on public health as well as development opportunities. So just briefly, what I want to call your attention to is this approach is stakeholder-driven. We develop methods and tools in partnership with our NGO partners and networks, as well as government and private sector. And public health is called out as its own dimension, which has not been done before. And some of the tools, just to give you a brief idea of how we're encouraging accountability and transparency, just an actual clear example is that we've developed surveys and activities that measure risk of households, communities, and public health institutions. So what this does is it allows us to do two things. One, it encourages our program to be accountable and transparent to our partners, to the people that we're serving and working with. It enables us to show, are we actually reducing risk? Did our policy, did our program actually reduce risk, improve preparedness, improve resilience, and if so, how? And if not, how can we improve on this? And this is something, again, that the post-2015 framework could really benefit from. We need to be accountable and show that these projects and policies are actually reducing risk, and how. And the other way is that it can show us insight around what communities, households, or institutions are at greater risk and why. Are they more vulnerable? Do they have higher hazard exposure? Do they have less resources and capacities? So it helps us also target our risk reduction interventions more specifically instead of just blanket approach to reducing risk, that it's really catered for each community and each institution. So here's some examples for public health indicators that we've developed. You can get at these a number of different ways, and I'm happy to talk to you all after the presentation as well. Just one example of how public health is completely inextricable from all of the other risk factors is, for example, in a community here in Japan, if there are issues with employment opportunities and there's livelihood insecurity, this can lead to mental health issues, this can lead to violence, gender-based violence, domestic violence, conflict, drug abuse. This can also lead to poor natural resource management, which can then in turn lead to environmental degradation and further hazard exposure. It gets at household food insecurity and malnutrition, and many, many others. So this is just to illustrate really, for those of you who are interested, that public health is inextricably linked to all of these different systems and has to be considered, has to be understood in order to have comprehensive disaster risk reduction. So just to show you some pictures of some of the work we're doing, these are pictures from El Salvador. We are rolling out our curriculum in a training of trainers approach. It's been done for decades around the world, and it's extremely effective. It builds capacity, education, and systems in the places that we're working. It's not just coming in as an external NGO, doing a project and leaving, but it's leaving all of the knowledge, all of the resources, all of the tools there in the community or in the institution itself. We're using low literacy methods and tools that engage the majority of the population. Some of them are no literacy, so that people don't feel left out in the process. We integrate gender mainstreaming, we're youth inclusive, and we're focusing on engaging all of community, because every member of community and the public health institutions has something really valuable to offer. They're all experts of place, and have experiences that are rich. And finally, part of this process is participatory risk and resource mapping. We do this from the very low tech to the very high tech, and we're basically combining the best of scientific knowledge, data layers on hazards and assets and vulnerabilities with local place-based knowledge. Again, because these folks are experts of their own place. And this informs their disaster risk reduction plans. So in closing, and I'm going to close with a few questions, and hopefully you all are enthused and will give some feedback, are the latest draft that just came out of the post-2015 framework for DRR is promising. There's anywhere from 36 to 35, we're still debating, references to public health. It's a promising start. There's also several references for integrating the SDGs, the relevant climate change convention, activities. That's all great, but we don't actually know how it's going to work, and we don't know who's going to be at the table. So right now we see this as a really big opportunity this week and in the coming weeks and months to inform the post-2015 framework, look at the specific targets and indicators for these to really capitalize on these opportunities and improve public health inclusion with very specific indicators that are adaptable but also appropriate for these different countries, understanding that reporting needs and reporting capacities can vary based on where you are. So in conclusion, I really just want to ask you all a question. Another quick poll, and then I'll ask an open question. How many of you think public health is important to disaster risk reduction? Okay, most of you. I'll try harder next time. How many of you think public health is well integrated into current disaster risk reduction and sustainable development goal frameworks? Okay, good. All right, so that's why we're here, and that's why we're working on this, is we're trying to really encourage better public health inclusion into the framework. So I want to close with a question to you all, and of course I'm happy to take your questions, but I just want to know, what are your biggest challenges with integrating public health and disaster risk reduction, whether it's response, relief, recovery, ongoing risk reduction, promoting resilience, and so forth? What are your biggest challenges? What do you see as opportunities moving forward? Anybody? I don't want to call on anybody that I see in the audience, and I know.
I think it's a great opportunity to put health-centered disaster risk reduction right in the middle of the whole agenda here. I think it'd go a long way. The WHO sessions that you're probably aware of will continue some of the things you've raised, so encourage people to attend those sessions tomorrow afternoon.
And what do you think are the biggest challenges as takeaways that we should focus on?
The challenges will be that health is a very broad area, but let's go back to 1948, WHO. Health is a complete state of physical, mental, and social well-being, not just the absence of disease or infirmity. I think if we stick with that, then we're building on past knowledge and bringing in the new knowledge, and we can go forward that way.
Great, thank you. Anybody else?
Thank you. I am Abdullah Kamara from the Gambia, West Africa. One of our challenges in public health in relation to DRR is the capacity assessment of health infrastructure and human resources. As we've realized during the outbreak of Ebola in the sub-region, that most of the health infrastructures have gone down and human resource capacity have really depleted. So in terms of emergency, really we needed those capacities to make sure that they are maintained in order to give health.
Thank you so much. That's a great comment. And it gets at not only community capacity building and education and outreach, but health infrastructure capacity. Thank you very much. I think I have to close now. Thank you.